Good afternoon, everyone, especially to the panel and the judges and people who have reviewed this proposal. As many of you will know, we went with the name CO-LUMINATE, which stands for Co-Creating Knowledge on the Longitudinal, Direct and Mediation Relationships between Youth Mental Health and Social Exposures. But it's also our hope that the title really speaks to what we want to do here, which is kind of give light to or bring to the light young people's understandings of the social determinants of mental health in South Africa, but also really actively involve them in cutting edge longitudinal analysis. I thought I'd take the opportunity to talk you through our team a little bit first, so that when people begin talking, you know who's talking. I am the team lead, and my name is Xanthe Hunt, and I have experience in sort of psychiatric epidemiology, population science, clinical medicine, and statistics. And we have in total 5 South African-based research scientists and associated staff on the project. We also have Nondumiso Mthiyane, who's here with us today, who's an early career biostatistician. Prof. Collins Iwuji, who isn't here today, but is going to play a role as an epidemiologist and also as the head of URI's Health and Demographic Surveillance System. We also have Kobus Herbst, who you can see in the slide in the yellow t-shirt. Kobus, also not here today on this call, is a population scientist and is the director of population science at URI and the director of SAPRIN. Here today, we are fortunate enough to have Kathy Baisley, who's a statistician and leads data science at URI. And then we have Zanini Kumalo, who is a peer supervisor who's working on some of URI's peer-led intervention studies. We will be complemented in our work by a youth advisory group or youth advisory board, which is comprised of young people coming from the community where our research is embedded. We'll talk a little bit more about that later. Can I have the next slide? So I thought it would be helpful to start off by just summarizing what we're seeking to do with this work, which is really kind of our mission. And that is to, through a process of co-creation and secondary data analysis, generate truly transformative insights into the longitudinal relationships between key social determinants of mental health and symptoms of depression amongst young people. Why are we wanting to do this? We know that about 34% of adolescents globally are at risk of depression, and 90% of the world's young people live in low and middle income countries. So the kind of proportional burden of depression is incredibly high, just by sheer numbers in low and middle income countries. We also know that settings like LMICs and many countries in Africa are characterized by intersecting and kind of cumulative risk factors that exacerbate the impact of these social determinants of health on young people. And while the kind of etiology of depression is multiply determined, we know it has biological, psychological, and social causes. What we have come to understand is that amongst those 3, the kind of biological, psychological, and social mechanisms, those which are social are under-researched, particularly on the African continent. So to summarize, we have these 3 issues as our starting point. The first is that most of the evidence about depression amongst young people was not generated in low and middle income countries. And yet we know 90% of young people live in low and middle income countries. We also know that little attention is paid to social and environmental stressors, and yet in LMICs, where most of the young people with depression live, these are precisely the types of stresses which are most likely to affect young people. And thirdly, we know that kind of mechanism science, so the science which is really trying to understand the pathways by which various influences result in conditions like depression, it favors empirical insights over lived experience expertise. Next slide, please. And that's where our solution comes in. We really want to create and analyze the CO-LUMINATE dataset, which links existing data on depressed mood at multiple time points, as well as potential behavioral mediators, from 5,279 adolescents between the ages of 13 and 24. With the household on their data's social exposures across the life course. These include things like food insecurity, like whether moms and dads live with their adolescents or away from them, and related factors like exposure to violence. All the while, though, we want to work with a youth advisory group of 10, 13 to 24-year-olds who live in the same HDSS community. We really hope that working with young people in this way will help us refine, guide, and nuance what we want to do with our analyses, but also, really importantly, our interpretation of the data to generate precisely the kinds of transformative insights that is the kind of undergirding mission of this research. So ultimately, our vision for this work, before we get into the methodology and all of the other kind of nitty-gritty, is really about trying to transform the way in which data-driven research is done and centering young people's lived experience in very empirical longitudinal analysis. The next is to generate a valuable data resource for longitudinal analysis. So having over 5,000 young people whose individual level data on their mental health can be linked to longitudinal data across the life course is really an unprecedented opportunity, and we would want to share this resource with our networks and beyond them. The next is to generate new knowledge regarding the mechanisms of influence of social determinants in depression among young people. And the final is to highlight potential areas for intervention to address depression amongst young people. We, again, know that many kind of behavioral and psychosocial interventions predominate in the mental health intervention landscape. And yet, if we understand how social determinants work, it may become clear what types of sort of structural interventions are most appropriate to support young people. I'm going to hand over now to my colleague, Nondumiso, to speak a little bit more about our solution.
Hi, everyone. My name is Nondumiso, and I'll be talking about our proposed solution in a bit more detail. So our solution has two parts. The first is that we are centering co-creation with youth. So at the beginning of our project, we'll convene a youth advisory group that will provide meaningful leadership to the research in a process of sustained co-creation. And then the second part of our solution is the creation and analysis of the CO-LUMINATE dataset. So now I'm going to talk about part one, which is youth co-creation. So our starting point and the rationale for foregrounding this group is to understand the complex relationships between social determinants and young people's depression, which often favor empirical insights over lived experience, expertise. And this does not only perpetuate power imbalances and increase distance between young people and science, which seeks to know them, but also means that lived experience, expertise is always positioned as separate to or on the periphery of science. So we're going to try and address this in our research by working with the youth advisory group of 10 to 13 to 24-year-olds living in Ari, Somkhed, HDSS communities. So this group will refine, guide, and nuance the proposed research through producing photo diaries to inform the research conceptualization of social determinants and their influence on young people's mental health. And they'll also provide input into the proposed analysis by producing lay-directed acyclic graphs based on group narratives building around the photo diaries. And then they'll also support result interpretations through workshopping the findings, and they'll be involved in a photo day exhibition town dissemination event to support dissemination of the findings in their own words and in relation to their photography. So, and the second part of our proposed solution, which will be fundamentally guided by the co-creation work, is to co-LUMINATE, is the co-LUMINATE longitudinal linked data set. So that's what this slide refers to. And in respect of the co-LUMINATE data set, the foundation has already been laid. So in partnership with the Aga Khan University, I worked on the Zima Data Science project. So in this work, I integrated data from a range of studies with measures of adolescent mental health into a harmonized individual level mental health data set for pooled analysis. So the studies that were included in this that harmonization project included DREAMS multi-level, is a Sekelo Sempilo, and treatment as prevention. Where Columnate comes in is that each of these studies was nested within the RE HDSS, which is located in the northern part of KwaZulu-Natal, and it was established in 2000. So in the HDSS, we collect information annually on births, deaths, and on migration, as well as also collect data on household level variables such as socioeconomic data. So over time, participants are randomly selected from the HDSS for various research studies, as shown in this figure. A number of these studies were included young people and collected rigorous measurements of depression at one or more time points, providing a unique data resource. So by linking the individual study data with HDSS data, we'll be able to examine patterns of exposure to social determinants and trajectories in young people's mental health with a focus on depression. Now, the harmonized individual level mental health data set that I mentioned earlier can be linked to the study participants' household HDSS data, allowing for longitudinal measures of young people's social and environmental exposures at the household level to be explored in relation to their depression symptoms.
Hi everyone, my name is Zanini Kumalo. I will be sharing with you the capacity building plan in terms of capacity development with the research. You can see there are plans for Nondumiso and others emphasizing during this project, but what I would like to focus on in this youth advice group, young people can learn research skill contributing to generation of knowledge and with the key stakeholders in their communities and a stipend through this research. All of this experience can make a youth advisors better advocate in their communities. For instance, before I was a peer supervisor at ARC, I was also a peer navigator, working on one of the projects which is including in the CO-LUMINATE data set. This experience of research projects fed into my interest in involving young people in research further, as I can in this position importantly the learning between the youth advisors group and research goes both ways, and the research team can also learn how to managefully engage with young people in research, learning about the living experience of the phenomena under study and learn how to live experience, emphasizing can elevate and expand science.
Hello, everyone. I'm Kathy Baisley, and I'm going to speak to you briefly about some of our uptake and dissemination plans. Some of our key outputs will include the CO-LUMINATE longitudinal linked data set that we will make publicly available. We will also conduct training workshops for other HDSS nodes on our methodology. We believe that there's a high likelihood of uptake of our methodologies, given RE's linkages to other South African HDSS sites through SAPRIN and to African population cohorts via the APCC. We will offer online workshops to interested teams on the methodology. And we've also budgeted for a 2-day data prize networking event in Kenya with other awardees to facilitate cross-study learning. We will hold a photo diary exhibition town hall dissemination event, which will be used to spur interest in the findings and galvanize action among key stakeholders. And we will use engagement such as this town hall to ensure that findings from the project are mainstreamed with stakeholders from a range of diverse sectors. This will be supported by RE's existing MOUs with government. And in partnership with RE's dedicated advancement department, we will develop designed findings infographics for lay audiences. The project team also have extensive networks within Africa in government, UN agencies, and networks such as SAPRIN and the United for Global Mental Health Network to support dissemination. We will liaise with the Youth Advisory Group and RE's Community Advisory Board in co-creation to collaboratively guide the production of stakeholder-informed community engagement strategies. At the start of the project, we will formulate an open science plan, and our dissemination and communication strategies will also encourage open science.
Right. So before we close this presentation, we just wanted to loop back to some of the really, really incredible feedback that we received on our application. I think just in general, it was very positive, and we felt incredibly buoyed that this idea has been kind of so warmly received. There were a few things that are a bit more sort of specific, and we thought it would be useful here to just recap our responses to those. So one of the questions which we had received from the reviewers was around the use of longitudinal latent class analysis, and that this is very useful, but that other analytic approaches warranted discussion. In a kind of similar vein, we had a question around describing the causal inference models that we're going to use and methods. So we will use causal mediation analysis, and I know that Nondumiso is able to speak to this very eloquently if there are further questions. But we will also use G-computation methods because our data are very longitudinal. So they have data on many people from birth up until the time point where the depression data is taken and following that. And they're very complex data too. But this method is very useful because it accounts for time-varying exposures and confounding as well as multiple mediators. The next question that we had was around psychometrics. So as you'll know, having read the proposal, that we were interested in looking at the Shawner-Simpson questionnaire and comparing it to the PHQ-9. And it's a very topical subject within kind of depression psychometry in sub-Saharan Africa. And so what we'll use to understand that are kind of your standard measures to understand psychometry of the SSQ. And then how we'll compare it particularly is kind of looking at the comparative sensitivity, specificity, and positive predictive value. Then one of the questions that we had received, which I think we've covered, but just to recap, is whether we have ethical approval for this curation. So firstly, the data harmonization for the original kind of pooling of these different studies with the depression data has been received. So ethical approval was sought and received from the KwaZulu-Natal BREC, and we have the reference numbers available. Another one of the pieces of feedback that we received that we thought it was important to respond to is that there is overlap between the membership of our team and the people at APHRC, in the sense that Iwuji and Kobus Herbst, who have roles on this project, are involved in the African Population Cohorts Consortium, which is an incredibly exciting initiative bringing together longitudinal cohorts from all over Africa, and APHRC is involved in that too. However, aside from the fact that Collins and Kobus are involved in that, Nondumiso and I and Kathy and Zanini are not. And so the way that we think about it is that our knowledge of APCC is very similar to our knowledge of any of our other networks. We would like to leverage them for the benefit of this methodology, but we do not think that the project as a whole is of direct benefit to the component sites. So we do not perceive a conflict of interest, and it's something that we're very happy to unpack further in the conversation. In the final comment that we received was that all applicants are from the same organization, from the Africa Health Research Institute, and that being multi-institutional would benefit the project. And we completely agree. So having the kind of intersectorality and having multiple different organizations and different areas of expertise represented is something that we always try to cultivate. However, URI is really unique in the sense that it's a research nonprofit. And so it's not a university. And so most of our faculty at URI have affiliations at other institutions. So to a certain degree, the multi-institutionality is baked in. So for instance, Kobus Herbst and I both have scientific affiliations at the South African Medical Research Council. I have an affiliation at Stellenbosch University. Collins Iwuji and Kobus Herbst both have affiliations at UKZN. And so we utilize those networks very much in the way that we would if we were coming from those different institutions kind of organically. And equally, one of the ways in which we thought about being multi-institutional would also be to involve NGOs and CBOs. And we do that in different ways. And one way which we had thought about when we were conceiving this work was to have a youth advisory group kind of from a third organization and bring them in. However, we've been doing youth advisory group and youth involvement for such a long time that we already have these structures and kind of our own relationships. And so it made it easier. And we think more, or kind of allows for a deeper relating, to have our own youth advisory groups rather than have a third party NGO sort of facilitate that. So while we have these different ways of collaborating kind of built into the proposal, we do understand that we're from one organization. And so it's also a point that we'd be really open to discussing and exploring with the panel. And if this were to be funded in kind of the final iteration, is to understand how to strengthen that, so that it really optimizes the reach and the impact of this work.